So there are a couple ways that kids can get tested for lead. One is called a finger stick test, where the kid's finger is literally pricked, similar to the way diabetics check their sugar, where they prick their finger and the little strip goes into a machine. This finger stick testing is not done at home like it is for diabetics, but it is done in many offices. And so they can obtain the level of lead in that office right there. And they can, what we call, screen kids to see if there's any concern about the reading that we're getting. Now, the other way, and I'm going to talk about what is a good reading for a result for a lead level, but the other way is just a typical venous blood draw. You know, how people go to the lab and they have their blood drawn through their arm.
What does venous mean?
Well, usually in the crux, right at the elbow, in the crux of the arm, there are veins that people can get their blood drawn. And I'm sure most families have members that had their blood drawn. So yeah, and kids get it done the same way. Parents obviously have to take them to a lab. And that is, you know, that the availability of labs is really limited in some regards, in some communities and some neighborhoods. So that's why the point we call the point of care testing, or the lead test that is done in the offices, was really initiated because it was challenging for some families to get to a lab to have the blood test done. However, if that finger stick blood test is any indication that it's an elevated lead test, then we like to confirm it with a venous sample, and that is a test from the arm. And there are several labs around, but you know, we have to admit that sometimes it's hard for families to get to those labs. So we do the ordering of it is easy to do, but it could be a challenge for families to get their child to a lab to really get that what we thought could be an elevated lead level, to get it confirmed.